this was a feasibility trial of chemotherapy plus atezolizumab. So phase 1 trial that was looking essentially at safety and feasibility. By no means there was a goal of this trial to make any kind of comparisons between chemotherapy and the regimen that has been used, so cisplatin plus pemetrexed versus versus that plus atezolizumab. So this was and this trial was not powered by any means to show the benefit of these drugs. And as I mentioned before, there's a tremendous heterogeneity in terms of treatment of mesothelioma that is where the surgical regimens are being used. There are people and institutions around the world, and even within the United States, where patients with what's considered surgically resectable mesothelioma undergo surgery up front without any neoadjuvant regimens. So when we make a comparison to these data that we have over here, that we have not reached, for example, in overall survival, we have not reached median overall survival. And I don't necessarily have the exact number, but just looking at the Kaplan-Meier curves, it appears to me that the median follow-up may be around 20 months. But I want to be very careful about overstating some of these results until this trial is completed, until the results are analyzed. The results also need to be analyzed in patients with mesothelioma based on their nodal status, for example. I know that at MD Anderson, in patients who have N0, so they don't have any disease within the lymph nodes and are surgically treated with multimodality regimens, median survival is approximately 20 months. So again, I don't want to overstate the results. I think that this trial still needs to come to its conclusion to make its final comments about safety and feasibility. However, the preliminary results that I have presented, I think, sort of speak for themselves. It's going to take us a while to make advancements, I think, in terms of phase 3 trials and get new regimens. It took us at least 10 to 15 years to go from the regimen of chemotherapy plus pemetrexed to nivolumab and ipilimumab in unresectable mesothelioma. That was the trial that was recently published within the last year that has basically established immunotherapy as a potential option for mesothelioma patients. So mesothelioma is still extremely difficult disease to treat, and everything that was mentioned about participating on clinical trial, advocating for these patients, reaching out to people who are even outside of the main institutions to come to main institutions that do research and that specialize in these complex treatments. I think all of that would advance not only results, but also care for patients, as it was mentioned over here.